And now with our special segment on vet tips and practices, here's Vet Call with Dr. E. Good morning, Dr. Easterwood. How are you doing today?
Hey, Rebecca. Doing good.
Well, I'm so glad you came out to the farm today. We're at the Salamone Stables, guys, to record Vet Call with Dr. E today. Well, unfortunately, recently we've had a horse that's passed away. We don't know if it's due to West Nile virus or not, but probably an insect-borne disease. So I thought it'd be time to talk about something like that today. So, you know, I guess talk about the importance of vaccinations and getting your boosters for folks.
Well, sure. I mean, in this area, we really worry about mosquito-borne illnesses, one of them being West Nile virus, which is mosquito-borne illnesses that birds carry, and the mosquito can bite the bird and then potentially transmit that virus to unvaccinated horses. And so that's why we really, in this area, we have a problem with mosquitoes. So we really like to try to encourage vaccinations twice a year is what we recommend to keep those horses with a high titer.
So what happens to horses that might get West Nile virus or something like that?
Well, initially, horses that contract West Nile virus, and again, we only see it in unvaccinated horses, but usually they'll start to spike a fever will be the first thing. And if a horse has a fever, then typically they will be just sort of lethargic looking and just kind of look like they don't feel well. And so a lot of times that can be a tip-off where you need to take your horse's temperature and see. Anything over 102 degrees in a horse would be considered significant.
Okay, now what about people that are showing and trail riding and going to rodeos? How important is it to vaccinate the horses?
It's very important. Again, these are mosquito-borne illnesses, so it's not transmitted from horse to horse. So a horse could potentially be exposed anywhere a mosquito could be. And just going back, also with the fever spike, you can also see some neurological problems with your horses later on in the disease. And so those are some other things that we could see also.
Okay, now there may be some folks that have, just pasture pets, and they may think that they don't need to get vaccinations. Is that true or not?
Well, that's untrue. Again, any horse can be affected with West Nile virus, especially if they're unvaccinated. The vaccine is so good, though, and that's why we recommend it, that typically if you vaccinate your horse, it's 99% sure that the horse is not going to get West Nile virus.
That's awesome. So today we're going to give Luke here his booster shot. So let me have the lead there and you can do your thing. So
this is Luke, and we're going to give him a West Nile vaccine. This is what we call the mosquito shot because it protects against other mosquito-borne illnesses like encephalitis. It's also got a tetanus vaccine in it. So this is a booster vaccine that we like to recommend giving twice a year. And it's also got the West Nile vaccine in with it. So we're just going to show you how we give that. Vaccines typically go in the neck muscle right in front of the shoulder blade, and it's a small volume, as you can see here, small needle. Most horses tolerate it really well.
And he doesn't seem to mind that very much at all, so it's not a difficult thing for the horses to go through. Now,
very, very non-painful, you should say. Like I said, most horses tolerate it well, and it's very efficacious, meaning that it works really good.
Okay, now just briefly go over what are the other names of the vaccines that people need to get.
The mosquito-borne illness vaccines, the mosquito-borne illnesses that we're concerned about would be West Nile virus, as we said, and then also your encephalitis. In this area we see Eastern and Western equine encephalitis. So those are the three that we worry about in this area.
Okay, great. Well, thank you so much. I appreciate it.
All right, Becca. Thank you for having me at Salamone Stables.
All right, and come back again. And folks, listeners and viewers, thanks for watching. And if you want to get more information on Easterwood Equine Hospital, you can go to easterwoodequine.com or call 205-663-4000. This is Becca Salamone, the voice of Alabama Horse Talk Radio, saying thanks for listening to Vet Call with Dr. E, bringing you tips and practices from the equine veterinary world. Submit your questions to alabamahorsetalk@gmail.com and stay tuned to hear your questions answered on Alabama Horse Talk Radio.